So if you've made the decision to enroll in a Medicare Supplement plan, the next question you need to ask yourself is whether you're going to go with Plan G or Plan N. Yes, there are 10 different plans to choose from, but honestly, Plan G and Plan N are really the only plans that anyone should be talking about. There are other plans, as I said, but I wouldn't consider them for my mom, and I wouldn't consider them for you. We do talk about the high deductible version of Plan G, which is something we'll touch upon in today's video, as well as those cost-sharing plans, Plan K and Plan L, in other videos. Honestly, if you are somebody that's looking to really save money on a monthly premium, I've never run the numbers that Plan K and Plan L end up working out better than the high deductible version of Plan G. But if that's been your experience, definitely let us know in the comments below. All right, let's get to it. So in today's video, I want to give you all the information that you need to know about the upfront cost differences in Plan G and Plan N, as well as the cost differences when you're actually utilizing your insurance. As health insurance brokers, our goal is really to make sure that our clients, our viewers, our subscribers are all as well informed as possible and empowered to make the best possible decisions for their health insurance needs. Medicare is one of the most important decisions that you're going to make when you turn 65, and it is a decision that unfortunately can have a critical effect on your retirement. If you make the right decision, it'll definitely make your retirement much easier. If you make the, well, I don't want to say incorrect decision, but the decision that's not as ideal for you, then it could certainly make your retirement a little bit more tricky. And of course, it not only affects your finances, but your access to quality health care as well. So definitely something that you need to take into consideration when making these decisions. They're not just affecting you in the short term, but in the long term as well. Medicare supplement plans, regardless of which plan you choose, all work in the same way. They're designed to fill in those financial gaps of Original Medicare. Original Medicare is Part A, which is your hospital insurance, and Part B, which is your medical insurance, basically anytime you see a doctor. And there are copays and coinsurance and deductibles associated with Original Medicare. That's where those Medicare supplement plans can step in to fill the financial gaps. They can help you to cover deductibles, they can help to cover or possibly entirely cover your copays and your coinsurance, and they can basically impose some type of out-of-pocket maximum because Original Medicare does not have an out-of-pocket maximum. Now, these costs associated with Original Medicare can be more significant than you might assume, especially when we're talking about Medicare Part A, because those are hospital costs. So when we talk about those out-of-pocket costs for Part A, your hospital insurance, and Part B, your medical insurance, really we're talking about deductibles and copays and coinsurance. There are premiums, not usually for Medicare Part A, but you have to pay those no matter what, so that's not really the focus of this video. So for Part A, your deductible in 2025 is $1,676. Now this is applied per benefit period, which is basically like per hospital stay. It can be a little bit murky, it's usually around 60 days, but again, you can think of that as per hospital stay. So should you need to be hospitalized more than once in a given year, you might need to meet that deductible more than once. If you break your leg in February, $1,676, and then you need to be readmitted in October because you fell again and now you broke your wrist again, $1,676. So that can really stack up. But that's not the only significant cost when it comes to Part A. There are also pretty extensive copays. Now luckily for days 1 through 60, there actually is no copay after you've met that deductible. But after that, it certainly gets expensive. For days 61 through 90, it's $419 per day. For days 91 through 150, it's $838. And should you pass 150 days, you pay for everything. Now, is that likely to happen? Probably not, but should you have some type of very serious and possibly debilitating medical condition, then you may be somebody who has significant copays. Skilled nursing facilities also have copays associated. For days 0 through 20, again, it is $0. But after that, for days 21 through 100, it is $209.50 per day. And should you have to stay longer than that, you pay all costs. And that is a little bit more likely that you're going to meet that basically 3 weeks and enter into a period where you have to pay significant copays. There are additional things covered under Part A, but many of those services, like hospice, actually have no associated cost. However, for something like durable medical equipment, like wheelchairs and walkers, then it would be 20% of the Medicare approved amount.
Then there's Medicare Part B, which is a little bit easier to understand. There is a deductible, however, it is a once annual deductible. In 2025, it's $257. So once you've met that, then you're responsible for coinsurance, which pretty much across the board for everything that Medicare Part B covers, which would be anytime you see a doctor, as well as any type of ambulatory services or diagnostic tests, imaging, MRIs, x-rays, anything like that. Basically, it is a 20% coinsurance.
A side note, when we're talking about the different parts of Medicare, today we're talking specifically about Medicare Supplement Plans. These are also known as Medigap plans. They are strictly a financial solution to the gaps of original Medicare. This is not to be confused with Medicare Advantage, also known as Medicare Part C. Medicare Part C is actually a replacement for original Medicare. So even though there may be some crossover in Medicare Advantage and Medicare Supplement plans, it's very easy to understand why people get confused between the two. They are two entirely different products. Also, you cannot have a Medicare Advantage plan and a Medicare Supplement plan together because, as I said, Medicare Advantage is a replacement for original Medicare. Medicare Supplement plans work in conjunction with original Medicare to fill in those financial gaps. So now let's get into the nitty-gritty of today's video, which are the similarities and differences between Plan G and Plan N to help you better determine which plan is right for you. But before we do, a super brief pause to remind you to please like this video so we can get this information out there, and of course subscribe to stay up to date. There are always yearly changes to Medicare, but in the upcoming years we do expect more and more changes to be coming to Medicare, so please make sure to subscribe to stay up to date. That way you are informed to make the best possible decisions about your Medicare coverage. Of course, if you have questions, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers, we're licensed nationwide, and there is absolutely no charge for our services. All right, let's get back to it.
So of what we discussed earlier, those out-of-pocket costs associated with original Medicare, Part A and Part B, Plans G and Plan N are basically going to cover everything except for that Part B deductible, which, as a reminder, in 2025 is $257. So not necessarily that big of a deal. The only real difference here is that with Plan N, there can be some additional copays, $20, $50 for possibly seeing a specialist or having to go to an urgent care. So again, it's rather negligible. We're not talking about huge costs here. And then Plan N will not cover those Part B excess charges, which basically, if your doctor chooses to contract with original Medicare, they're willing to accept the amount that Medicare is going to pay out. However, doctors can choose to charge up to 15% more than that. This is what's known as a Part B excess charge. Now, in all honesty, they're not that common, and they're not even allowed in all states. So it's certainly not something that I would make a decision based upon.
So as you can see, Plan G and Plan N are extremely similar. And quite frankly, some of those differences, those Part B excess charges, as well as some of the copays that may be applicable with Plan N, in my opinion, I don't really think are enough of a decision-making factor to help you determine whether to go with Plan G or Plan N. It's really going to come down to the monthly premium that you're able to access. If you're able to access a much better rate with Plan G, then Plan G is probably the way to go. If you're able to access a much better rate with Plan N, then Plan N is probably the way to go. However, there's more to take into consideration here. Remember that on a yearly basis, these premiums do tend to increase. However, some carriers have a history of lower, more stable rate increases than others. And once you have enrolled in a Medicare Supplement plan, you're pretty much locked into that plan for life. Also, there's the issue of attained age versus issue age versus community rated plans.
The three main types of plans are issue age, attained age, and community rated. So issue age, your plan rate is determined by the age you were when that plan was issued to you. As a result, these plans tend to increase at a less dramatic rate than other types of plans. For example, an attained age plan. Now, the price that you pay for an attained age plan is based on your age every year. So you can see why these types of plans might have a more dramatic rate increase. And then a community rated plan sort of splits the difference? It's based on the location in which you live and the overall age and health where you live. So you might have access to a plan with a lower monthly premium if you live in a rather young, healthy area, but if you live in an older community, you might see plans with higher rates.
Now, as I mentioned earlier, once you enroll in a Medicare Supplement plan, you're pretty much locked into that Medicare Supplement plan for life. That is because you are only guaranteed issue your Medicare Supplement plan without medical underwriting in the first 6 months after you enroll in Medicare Part B and turn 65. Should you choose to enroll outside of the 6-month window, or even switch carriers or switch plans outside of the 6-month window, then you may be subject to medical underwriting. That means you could be charged more or denied outright. Now, there are some exceptions to this. Certain states do have more lenient rules than others, and many states are actually looking to jump on this more lenient enrollment approach. We do have a video dedicated to that, and I will put that at the end of this video. Now, this is one of the many reasons that it's much easier to work with a broker. They have access to the year-over-year data, which I'm certain you could research on your own, but it's certainly going to be a lot of work. Anyway, they'll be able to provide you some guidance and tell you, yes, this carrier has a history of lower rate increases. This one just jumped last year and is a bit more erratic than others. And they'll also probably be able to give you some guidance as to which Medicare Supplement Plan carrier has better customer service. Hopefully it's not something that you will need to deal with on a regular basis because, as I said, it's really just a financial solution, no pre-authorization or referrals for specialists or anything like that. But still, it is good to know that the carrier that you're working with is easier to get in touch and more receptive. I'm sure you've got nightmare stories about carriers that have been particularly difficult to work with. Feel free to let us know in the comments below so we know who to avoid. But that being said, even though Medicare supplement plans are offered by private carriers, other than your experience with the carrier, it doesn't really matter as far as how you're able to use your insurance. Because if your doctor accepts original Medicare, they accept your Medicare supplement plan regardless of who the carrier is. So let's say your carrier is Aetna and your doctor doesn't accept Aetna for regular insurance purposes, but they accept original Medicare, they're still going to accept your Medicare supplement plan. Now that you have a better understanding, let's move on to those financial aspects of Plan G versus Plan N. As we discussed, some of the out-of-pocket costs are really rather negligible in their differences, so really let's focus on those monthly premiums. So I've put in North Carolina, New York, and Michigan. Now, first and foremost, there is a little bit of, health questions up here, your age, your sex, and whether or not you use tobacco. And you'll see if you don't put that information in, you're going to have a ridiculously broad range that would be near impossible for us to discuss prices when you're looking at plans that could be as little as $94 to up to almost $1,700. So to keep things even, I'm going to put in 65 female and no for all of the different states, and we're going to update our prices. So right now, let's scroll down and we're going to look at Plan G and Plan N. So for Plan G, we're looking at plans that range between $95 to $349. So what's affecting that price right now? Just the carrier, because right now we're looking at plans without medical underwriting. So let's scroll down to Plan N. Looks like you could get a plan for between $71 to $302. So let's see. They're pretty comparable. In all honesty, for this, it's going to depend very heavily upon the carrier that you choose and the rate that you're able to access. So if you're able to get a Plan G that is on the lower end of the spectrum and a Plan N that's, maybe on the Plan N that's on the mid level of the spectrum, you'll definitely save money with Plan G. But it is pretty comparable based on the information that we put in here. Let's check over in New York. Again, I'm going to put in the same information to keep things even. Update those prices. Let's scroll down. Plan G between $325 to $826. Plan N between $260 to $515. So again, it depends on the carrier you choose. But in New York, it looks like you would probably save money with Plan N, most likely because $260 to $515 versus $325 to $826. Yeah, you'll probably save money with Plan N. Again, it depends on the carrier that you choose, but it seems like Plan N is skewing significantly lower in New York, or at least based on the zip code that we put in. Finally, let's again put in the same information. Update prices. Let's scroll down. Plan G between 109 to 416. Plan N between 86 to 434. This is a little bit more even, perhaps not as even as North Carolina. Plan G is skewing a little bit higher, not as drastically as New York, but it looks like you might save money. It looks like Plan N might have a slight edge here in Michigan based on the zip code that I put in, but again, not too much. So it looks like in the states that we put in, Plan N might have an ever so slight edge, but again, more often than not, they're pretty even, so it depends on the carrier that you choose. I mentioned earlier that premiums do tend to increase on a yearly basis to accommodate for rising healthcare costs and inflation. However, some plans increase more rapidly than others. In the past, when Plan F was still being offered to new enrollees, it was often noticeable that Plan F would increase on a yearly basis in a more dramatic rate than Plan G. That being said, with Plan F being phased out, it is possible that Plan G, because it will now be the most comprehensive coverage offered to new enrollees, Plan G may increase at a more dramatic rate than other plans. Again, this is something that you're going to want to speak with your broker about. If you want to learn more about Medicare in general, make sure to check out our Medicare playlist over here, or if you want to learn more about that Medigap enrollment, those changes that are coming down the pipeline that I mentioned earlier, you can check out this video over here. Of course, please make sure to reach out in the comments below with any questions or concerns, or you can give us a call at the number on the screen. And before you go, make sure to like this video so we can get this information out there, and subscribe to stay up to date, because there are definitely some big changes coming down the pipeline. As always, thank you so much for watching and have a wonderful day. Bye-bye.